Thank you for joining me on this wonderful Thursday. I hope your week has been going great. I wanted to kind of catch up with you on some news that's happening about COVID. My hair is getting all in my way. Sorry about that. But talking about COVID, and the numbers are continuing to rise. We talked about this last week, but here in Houston, because I can only talk about what's going on here, but I'm hearing this around the world basically. The numbers are starting to increase, and it's almost looking like we're going to have another shutdown, guys. So again, just to recap, make sure that you are getting your COVID testing done, and think about what you're going to do for Thanksgiving, because having a group together or gathering together like you normally do is probably not the best idea at this time. And that's really disappointing for me, because we usually gather up, as I said on previous broadcasts, that we gather up at my mom's house. She's the oldest, or one of the oldest in the family. So we normally gather at her house, and it's a little disappointing that we may not be able to do that. So just kind of remember from the last broadcast about doing Thanksgiving COVID style, maybe just a few people at a time. But now I'm hearing that that's not even a good idea. So what they're saying is they really would like for you to just have Thanksgiving with the people in your home. And that's not such a bad thing, but keep in mind that we've been stuck in the house with these people for since March of last year. So I love my children to death, or to life rather, but I'd much rather see some more faces than maybe somebody my age at least. Just being silly, but seriously though, to think about your health and the health of others, it may be a good idea this year to forego the family gatherings and, try to think of other ways to spend your Thanksgiving. I was actually sitting there thinking of some things that I could do with my family, because I cook for my family, and then a lot of times I cook either the full meal for my mother or just the dessert. So being able to get those things over there to her and spend a little time with her. So she actually comes over to my house every day. I work from home, and my oldest daughter works from home. So she takes care of my grandbaby. So we're able to, do our jobs, and also I homeschool my kids. So I'm pretty busy throughout the day. So she comes over to help my daughter with her daughter. And I'm thinking maybe doing some type of before Thanksgiving with her, since she's at my house, instead of us all piling up over there. It'd be different if I didn't expect tons of family to come by, but that's normally what they do. So I still hadn't decided if I was going to put a post in our family page to say, don't go to my mother's house. I'm going to talk to her about that probably tomorrow. But anyhow, I just wanted to bring up, the reason I'm bringing up the COVID pandemic again is, one, the numbers are rising, and two, I want to encourage people to get tested. Here in Houston, if you remember, I talked to you about a young boy with the last name of Taft. He had created his own mobile testing unit, and it's here in Houston, which is doing remarkably well. Well, now I have another young lady I would like to talk about and her contributions to the pandemic and a solution for that matter. Black family nurse launches her own clinic in Houston to provide low-cost medical service. Now, that is amazing, because one of the things that you have to keep in mind, there are tons of people that are not working. So if your job provided you with health insurance, now you don't have health insurance. So they're encouraging people to go get testing done, or if you're sick, they're encouraging you to go to the hospital. But that's a little scary for people that don't have insurance. They either have to go wait in extremely long lines to try to get free testing, or extremely long lines at the clinic to try to get free health care to make sure that they're okay. So that's kind of scary, So I'm excited to tell you about this, and I hope to one day meet her, because she sounds like a fabulous person. And I love all my nurses, everybody that's a nurse like me. I'm not biased or anything. But anyway, Miss Kimberly Barrow, she's a nurse practitioner, incredibly accomplished family nurse practitioner from Jacksonville, Florida, who has taken Houston by storm. Disheartened by the healthcare disparities in the community, she established a family medicine clinic called Kimberly Cares LLC, to provide low-cost medical services for adults and children. Her practice has served thousands of clients to date with plans to further her expansion. Kimberly Cares offers a number of services, including general wellness, women's health, pediatric, weight management, Department of Transportation testing, and other occupational health services. As a Navy veteran and current Air Force flight nurse, Kimberly is also contracted to provide services for veterans. That is amazing, because I have went to the Veterans Hospital for a shift. I did as needed nursing. They call it PRN staffing. And I went there for one shift, and that is so heartbreaking to see the numerous amounts of people waiting and waiting and waiting for healthcare. The waits are extremely long. So this is wonderful that she's able to help the veterans as well. She has taught both undergraduate and graduate students, has participated in a number of small business panels, has addressed audiences as keynote speaker, and has even created a small group to mentor other aspiring businesswomen and clinicians. Her ambition and passion for service helped her become one of Houston's elite business women. She comments, "Quality of life is at the center. I'm driven by the passion to serve, and I tend to do just that, because at the end of the day, we're all we've got." That is amazing, and I love the story. I love the fact that it's happening here in my hometown. I love the fact that it's servicing such a need in Houston. As you drive through downtown areas, the hospital areas, they're overrun by people, sitting and waiting in the waiting rooms. The hospital that's for the veterans, it's the same thing. My daughter, her little girl's father is a veteran, and when he has to go just for a clinic appointment, it's almost like an all-day affair. So that's something else that needs to be addressed in the healthcare field, is our veterans. And let's not forget about our elderly patients. When I take my mother to the doctor, it's a long all-day affair as well, because most of the times as Medicare recipients, they are sent to particular clinics. And when you go to a clinic, you sit there and wait, even if you had a scheduled appointment. Well, during October, which you're able to change some of the services, like with your job, they give you the ability every year to change your elections or selections on your healthcare insurance. And they do the same thing with Medicare. So each year I sit down with my mom and her Medicare book to try to find the best option for her dealing with what she's dealing with at that time. And one thing I was able to do was get her a doctor where she don't have to wait in a clinic setting. She can actually see her doctor at the proposed time, or let me not say that, because not all doctors, you have an appointment at 11, you're not seen till 1. But hers is a bit better. If she has an appointment at 11, she is seen at 11. And I love that set up that way, because it was difficult to go and sit in a clinic with her, for long periods of time to see the doctor. They spend about 6 minutes in there, barely listening to what you're saying, because they've sent an intern in there. And then you're back at square one trying to say, well, no, she doesn't need that medication. She already has that. But a lot of people don't have someone in their corner to do that. A lot of people don't have the ability to get to those things. So having this clinic available and already knowing that once you go to the doctor at that clinic, you're not going to be met with an enormous bill, as my mom is. When we go to the doctor with her, it's a $75, well, let me say $40 to $75 copay, depending on if she's seeing a specialist or not. A lot of the things she gets free, like, the wellness checkup, the mammograms and things like that, just like we do. But when it comes to her clinic visits, that's expensive on the income that she's in. It's expensive to me to have a copay of $40 to $75 each time one of my family members go to the doctor. And that's one of the things that deter people from not even going. If you're low income already and you're trying to go to the doctor and your copay, maybe you work too many hours and make just a little bit too much to qualify for Medicaid, and you have to take out your company's insurance, that $40 copay can make a break if you're going to eat or not. So To have a low cost facility like this servicing the area, it's amazing. And maybe that'll encourage others to get out and go to the doctor and not have to worry about the financial side of it. You know, I am not aware of what her prices are, but I'm pretty sure I'll do some research and find out more information about what her clinic offers and maybe some estimates of what the pricing may be. And I definitely would come back and let you know. But it was very exciting for me to read this story because it hits home. You know, I know what I deal with my mother and going back and forth to the doctor with her. And if you have someone with chronic conditions, then that's continuous appointments almost monthly. You know, it's a difference between me seeing the doctor maybe once for my well woman exam or my physical, which is free, and then going back for a sick visit. I don't get sick that often. I do have a chronic condition, but it's managed with medication. So I don't have to go to the ENT specialist that often. I just went maybe a month ago. I go every 6 months, you know, so unless things get worse with the vertigo, then I'm okay. You know, and that's not necessarily having to get medication if I can catch it in time and handle it myself with the tools that they've given me. But if not, then I'm at the doctor with another copay. So I can only imagine how that can be for someone that's already with low income. So I hope this was very helpful to you. It was exciting for me to talk about. It's my, Houston native, and she's a nurse and she's doing good work. Please, please, please remember, think about what you're going to do for Thanksgiving. Remember that we're in a pandemic. I know it seems like we've been in it forever because we have, and people are kind of getting laxed about it, but the numbers are going up, guys. So get tested. If you haven't been tested in a while, it's probably time for you to get tested again, and keep wearing your mask. Keep following the mandates. Keep yourself safe. Thank you so much for tuning in to Relationship Entertainment TV. I'm your host, Felicia Dortch, with the news you can use and the ish you don't want to miss. I'll see you Tuesday.